Hi, I'm Dr. Molly with Your Goals Physical Therapy. Are you looking for a way to fix your carpal tunnel? This video is perfect for you. I have treated and worked with numerous active adults who have come in suffering from numbness in their hands to the point that they can no longer hold a glass without fear of it falling. They don't pick up their cell phones without two hands because they're afraid that it's just going to hit the floor. It has encroached on their ability to do their job because they can't type for very long. Forget about using a mouse. It just makes their entire hand go completely numb. And then there are other people who they have to turn things all day and they've lost their ability to grip anything at all. So as you can imagine, it becomes very, very debilitating. And for many people, the reason that they have delayed seeing somebody is that they assumed that the only solution was to have surgery. And because they didn't know if they could take themselves out of their life for 6 to 8 weeks as they healed from the surgery, they didn't want to even go talk to a doctor about how to deal with their carpal tunnel. So it just progressively gets very, very bad. So in this video, I am going to talk about how you can fix carpal tunnel without surgery. I'm going to start with defining what carpal tunnel is, how you diagnose it. We're going to talk about what the root causes of carpal tunnel are, and then we'll get right into a few things that you can do to treat it. All right, so let's get started. First, what is carpal tunnel? Well, very simply, carpal tunnel is the impingement of, or the pinching of the median nerve in your arm. So all of your nerves start in your neck. They come out of the spine and they go across the front of your shoulder, and then they go down your arm and they go through what's called a retinaculum into your hand. So, through the retinaculum is a little misconcerting because it's not a small thing. It's actually a little band on the top of your wrist, and it helps to support the front part of your wrist because you have nerves, you have bones in there, you have tendons, ligaments for a bunch of different muscles. And so it just helps keep it all nice and tight. I would think of it as like kind of a wristband, but it's just permanently in there. And so a lot of times the surgery for carpal tunnel is to just cut that retinaculum and allow more space for the nerve so that it's no longer being pinched. But that's a little bit about the surgery. I got ahead of myself, but now, so that is simply put what carpal tunnel is. It is just the pinching of that median nerve. And what that typically gets for people is some form of numbness in their hand. If it's just the median nerve, then it should be your thumb, your pointer finger, and your middle finger. You'll get some symptoms on the back of your hand as well. But it makes gripping very difficult if you can't feel where those fingers are. Now, how do you diagnose it? There are several ways, but one way that physical therapists and other practitioners can do it as well is by simply having you do little movements to see if it pinches on the nerve. So really a lot of the tests, or all of the tests that we would do would be something that would make the symptoms come on, and that just tells you that it really is the median nerve that is being annoyed. So one of the tests is simply having your wrists folded down and just having that pressure there for a sustained amount of time, about a minute. And if the symptoms come up, that would be positive and would indicate that you possibly have carpal tunnel, and you would proceed with other tests. So that's one way. You can also tap the nerve to see if that makes it annoyed. Some of these take a little bit of, to do it correctly, takes a little bit of practice. So like I wouldn't just go tapping nerves because you can annoy a lot of things. And please don't sit here for 5 hours trying to get symptoms to start up. It really isn't supposed to take that long. Now, here is what I think the crux of this video is what is the root cause of the carpal tunnel? And as I pointed out, the surgery implies that the root cause would be something that somewhere in here is where the nerve is being pinched. But that's not the only place that nerve can be pinched. That the median nerve can be pinched anywhere from coming out of the spine, across the front of your shoulder, and down your arm. And so in some cases, You can have something going on in your neck. You could have something going on with posture that's causing that pinched nerve, and or something in your wrist. Some people, you could have something happening in more than one place that's actually causing it. So it's getting pinched in your neck, it's getting pinched in the front of your shoulder, and it's getting pinched in your wrist. So just cutting the retinaculum isn't necessarily going to resolve all of your issues. So this is where I root for non-invasive things, or at the very least, a full assessment of the whole area that could be affected by that median nerve. So now I've actually treated some people, and I came up with 2 examples that I wanted to talk to you about that kind of highlight these things. So Tim, was a machinist. So all day he did the same thing repetitively, and it was always twisting. Like, he described everything he did, and it was all this twisting motion. And based on the size of his forearms, his grip would have been very, very strong. They were very, very large forearms. And so, and that was from years of working, because he's in his 50s at this point. But when he showed up, it was sort of as a last minute. He just sort of showed up, didn't have an appointment. He just wanted to find out what the rehab after having carpal tunnel surgery would look like. And so I asked him a whole bunch of questions. I could tell he's a little bit annoyed, but he did end up coming in to have a pre-surgery evaluation, because he just could not imagine getting any of the feeling back in his hands without having surgery. So he just assumed that that was the right route for him. And when he came in, he had absolutely no grip strength. Like, he could not hold a pen, and he had numbness and tingling. He said it felt like he had socks on his hands all the time, but it would get worse where he just absolutely couldn't feel his hands at all. And so we did an assessment. We looked at neck, we looked at shoulder, and we looked at his wrist. And without question, like most people, everybody's posture could be better, but that didn't really affect him. But his wrist had absolutely no mobility. Nothing. There was nothing there. That he could not move his wrist this way to save anything. And so I spent sometime 15-20 minutes working on his forearms to try to help loosen it up and do some other manual techniques to help get some more mobility in his wrist. By the time he left, the sock sensation had gone, and his eyeballs were the size of dollar bills. He just could not imagine that any of his symptoms could be made better without having to have surgery. We were able to work together for the next several weeks, because ultimately we wanted him to get strong enough to do his job. And at the end, he had no numbness and tingling. He had near normal range of motion in his wrists, and he knew exactly what he needed to do to keep doing his job as long as he wanted to do it, because he was obviously going to have to make some changes to what he was doing so that it didn't come back. So he was very, very excited. Now, Sarah was early 40s. She had young children, and this onset was much quicker and a lot more scary for her, because it was like she was fine one day and she felt like she was not good the next day, but she had that numbness and tingling in her hands. She also felt a lot of strain everywhere else, but she couldn't decide if that was because her small children that she was still carrying, all the typing she did at work, and she also played tennis. So all of those things all used the same side she was having a problem with. And so when she was gripping the racket with her right hand, she felt like she didn't have the strength. She was like, it was very embarrassing the first time the ball hit her racket and the racket flew out of her hand and almost hit the person behind her. But that was what she was going through. And so that's where she decided she would actually come and see somebody. But she was telling me that she was having more problems if she had to hold her kids on her right side versus on her left. She was waking up with a lot of aches and pains, and her hand would be numb in the morning, which was very, very scary. And so when she came in, really, she just wanted to be able to get back to playing tennis. She needed to be able to hold the racket and to be able to hold her kids. Well, when we looked at it, it was her neck. We found out that she had something going on in how her neck alignment was working. So when we addressed those, then that she stopped waking up with numbness, she was able to get back to playing tennis and not being afraid that she was going to have a surgery on top of holding kids, because you can't stop holding on to your kids. You can stop playing tennis for a little bit. You can't stop picking up your kids. It's very, very difficult. So it was a huge weight off of her when she came in and she found out exactly what the root cause was, and she had a clear plan on how to get rid of it. And when she left the evaluation, we already knew ways that she could adjust her sleeping position and her workspace to help her resolve her issues. So that was Sarah. And that is that kind of brings me down to what the non-invasive treatments are. So once you find out what the root cause is it coming from your neck? Is it coming from your wrist? Once you find that out, then it's all about, you need to, you create a plan with stretches in it, because most of us get stiff and tight, and that is causing undue stress and strain on our tissues. And in this case, if you're getting numbness and tingling, it's causing that tightness is causing stress on your nerve. So wrist stretches, I'll just give you a couple quick ones. So if you put your hands flat together and then bring your hands down, so you don't want your shoulders up here, you just want to bring that hand down to where you're as far down as you can, right? So I mean, if you don't have this much range, you don't come this low. But the idea is to get it to where everything, the heel of your hand still stays together, your fingertips are flat on each other, and you just bring those down to where your elbows are pointed out. And you can hold that for 30 seconds or a minute, whatever you can tolerate. And what that does is that helps stretch all of these muscles out. Next you can do is like strengthening exercises. If it's your wrist that we're trying to strengthen, then working on anything that helps move your wrist in through these full range of motion. So how far up can you go? How far down can you go? Nice and easy, just working those. Now, posture. Posture is a little bit harder to give you an example because it depends on what you're doing with your posture, but if you can stand up as straight as you can imagine and pulling your shoulder blades back, getting your head back, and trying to maintain that for as long throughout the day as you can. If you just allow yourself to fall forward, then you're going to be adding a lot of pressure to all the nerves inside the front of your shoulder, because everything just collapses in. All right. Now, your desk space. That can be a huge culprit, especially if we work on laptops like many of us do. And so you're gonna have to give up working on your couch in that nice slumped position. This does not help anything. So your workspace should be set up as ergonomically as possible. And that is just a fancy way of saying that when you sit at your desk, you should be in the most upright position possible. You shouldn't have to reach really far to use your mouse. Your monitor should be about eye level so that you're not having to crane one way or the other. You're not having to look up really far. You're not having to look down really far, because that just helps you stay in a much better alignment and put less stress on things. There's lots of people that are using stand-up desks, and depending on how that's set up, it would be the same. Ultimately, it'd be the same concept, whether you're standing or sitting. The nice thing about the stand-up desk is you get to change your position, right? You can stand up for a little bit, you can sit down for a little bit, and changing positions is always better. You're not designed to spend 8 hours a day sitting in the same position. But really, you can get ergonomic assessments. A lot of companies actually offer those. So you might ask your boss if there's a team that can come in and look at your workspace. Now, the fifth one, and the fastest way to figure this out, is to work with a movement specialist like myself. Find somebody in your local area, or call me, and find, that way they can help you go through all these things that I've talked about. Carpal tunnel initially seems like it's such a simple thing. It's just your wrist has got a problem. But really, the pinching of that nerve can come from a lot of places. And you could do all the wrist stretches in the world and you do all the strengthening, but if it's coming from a different part on that nerve, where that nerve, what am I trying to say? a different line, or a different spot on that nerve from your neck down to your wrist, if it's not just coming from your wrist, then, I mean, not that those exercises are for nothing, but they're not necessarily going to help you. And it doesn't mean that nothing would help you. And so the fastest way to do that is to have somebody do a physical exam with you and come up with a specialized program just for you to help you get back to the activities that you really want to get back to. If this is the type of service that you're looking for, I'm going to leave a button that says ask about cost and availability, and that will take you to a form. You'll fill out the form and my office will get back to you. If you have questions, maybe you've tried carpal tunnel surgery or you're still on the fence on whether or not physical therapy or movement specialists could be of help, and you want to chat for a few minutes before you commit to anything, that's awesome too. I love having conversations and answering questions. So you would simply click on the button below that says talk to a PT. There's also a form with that, and that way we can set up a time that works for both of us. We can talk for about 20 minutes. I hope that this information was helpful and that you're having a lovely day.